Thank you. So now we can go to liver function and liver function test. I also have objectives here. So I will want you to be able to give an overview of the anatomy and physiology of the liver at the end of this talk. And I will also want you to be able to describe the normal functions of the liver. And then I would like you to highlight the indications for liver function tests. And then at the end, we would probably discuss the main clinical applications of liver function tests. Now, the liver is the largest organ in the body. It weighs between 1.2 and 1.6 kilograms, averaging 1.4 kilograms, and this is 2% of the weight of an average adult. So the liver is the largest internal organ. It is located below the diaphragm in the right upper quadrant of the abdomen, of the abdominal cavity, the upper quadrant of the abdomen. It extends approximately from the fifth rib all down to the lower border of the rib cage. So actually, a majority of times people think the liver is intrathoracic. You see, with the upper abdomen, which is covered by the rib cage. It has two lobes. One is the largest lobe, is the right lobe, and there's a small lobe that extends to the left. So most of the liver is in the upper right quadrant of the abdomen, but an extension to the left, which is significant. The two lobes are separated into two different lobes, but functionally they work as one unit. This is what it looks like. Anatomically, this is what the liver looks like. The left lobe is slightly smaller than the right lobe. The significance of the left lobe in clinical setup, it is the part of the liver that is early to palpate when the liver is enlarged. So in hepatomegaly, the first part of the liver that can be palpated is the left lobe. That is also part of the pictorial presentation. So the liver is separated into a right and a left lobe, and it is separated by a ligament. And this ligament is called the falciform ligament. I've said the right is much larger. Although this ligament is formed by a double-folded peritoneal membrane, it does not prevent the liver from functioning as a single organ, one single or unitary organ. This infolded peritoneal whatever still allows the left and the right to communicate. So that is the picture of the folded liver, or the two left and right lobes of the liver. Okay, and that is the posterior view, and these are the pictorial presentations. You saw this in anatomy the other day. So the liver has got two main sources of blood supply. The first is its own, called the hepatic artery, which delivers oxygenated blood from the general circulation. So the liver is supplied by its needs. So its arterial or blood needs are given by the artery. The second is the hepatic portal vein, which delivers the oxygenated blood. And the main thing that is in this deoxygenated blood is the nutrients that are contained. So this is the main supplier of materials that will be used by the liver for its main function. So this is you can see the artery is small, the vein is quite large, and the vein pours in a lot of nutrients to it. The working cells of the liver are known as hepatocytes, and they have a unique capability to reproduce. And this means that they can respond to injury. So this regeneration can occur after surgical removal of the portion of the liver or after injuries. So the liver is able to retain its own texture after an insult. This is not to say that the liver cannot fail. So repeated injuries can be able to make the liver go into failure and even death. So liver failure can occur from repeated insults. The liver has got these same functions. I'll start with metabolic. This is the main function of the liver. So the liver actively participates in carbohydrate, lipid, protein, and mineral metabolism. Okay? So the first function of the liver is the most important one, and these are subsidiary functions. So I'll go through these functions a little in slight detail. So we start with carbohydrates. The liver receives glucose from carbohydrates that we ingest. When we ingest carbohydrates, glucose goes into the, carbohydrates are broken down into glucose in the small intestines, and this is taken up by hepatic portal vein and is taken to the liver. The liver initially utilizes this glucose for its own needs, so it does break down the glucose. So the first metabolic function of the liver on carbohydrate is glycolysis, breakdown of glucose to enter into Krebs cycle to generate energy for hepatocellular needs. A second function in carbohydrate metabolism is to repolymerize the glucose to form a storage molecule called glycogen. So glycogenesis is a second function of the liver in carbohydrate metabolism. So glycogen is stored. In starvation or when we do not have exogenous source of carbohydrates, the liver generates glucose for the body's needs from non-carbohydrate materials like amino acids, lactic acid, and free fatty acids. This process is called gluconeogenesis. So the liver in carbohydrate metabolism generates glucose by gluconeogenesis. The liver also synthesizes compounds that are required for cell membrane like glycolipid and glycoprotein. And when the glucose goes to the liver, the glucose initiates formation of glycolipids and glycoproteins. So that is metabolism of the liver's function in carbohydrate metabolism. Carbohydrate metabolism is unique to every cell. So the liver is not the only organ that synthesizes and stores glucose. So assessing glucose in circulation is not necessarily an assessment of liver's dysfunction. So carbohydrate metabolism is rarely used to assess the liver's dysfunction, although the liver's metabolic capacity can be assessed from carbohydrate metabolism. And this is on the utilization of other sugars other than the ordinary carbohydrates, like galactose, can be used to assess the liver's functional metabolic function. The second metabolic function of the liver is on proteins. So proteins are the main material synthesized in the liver. We ingest proteins from outside, and when we do ingest them, they are broken down in the small intestines into amino acids. Once the amino acids are made, these amino acids enter the hepatic portal vein and they are channeled to the liver. So amino acids are isolated or grouped into similar amino acids and stored in the liver. So in the liver, we isolate pools, or we make pools of amino acids on ingestion of a protein-containing meal. So we do not incorporate the exogenous proteins, but we take amino acids from these exogenous proteins and store them in the liver. Then as we need proteins, the liver synthesizes them for us from these amino acid pools. So the liver picks the amino acids required from the pools and generates the proteins that we need. So protein synthesis is done solely by the liver. The main protein synthesized in the liver is albumin. And albumin, as I told you, is the main, so that's the, give us the plasma protein oncotic pressure. It transports materials, and it also, it's a nutrient. So plasma protein, albumin, synthesized solely by the liver. So the other proteins synthesized by the liver are the other globulins that are in circulation, and we talked about those ones. Coagulation factors are synthesized in the liver, and they all go into plasma. So all plasma proteins are synthesized in the liver, okay? And assessment of the quantity of plasma proteins will be useful in determining the functional integrity of the liver. So when the liver is failing, the proteins in circulation will reduce, particularly albumin. So liver failure, we can be able to use this synthetic function to assess the liver's dysfunction. The other thing that the liver does is that from the pools of amino acids, we can be able to generate energy, energy processing materials. There are proteins, amino acids called glucogenic amino acids. And when we are starving, when we do not have enough energy source from carbohydrates, we can be able to utilize amino acids. And I can give you two examples. The liver utilizes aspartate in order to generate oxaloacetate. The process is called transamination. So aspartate, using an aspartate amino transaminase, is able to give you oxaloacetate and glutamate. So we generate one amino acid, and we also generate a glucose intermediate. So oxaloacetate enters into Krebs cycle. So we can be able to get energy from aspartate. This transaminase is generated by the liver cells, and it is for this function that of making amino acids available to generation of energy, and generation of a new amino acid, glutamate. The other one is alanine, and alanine amino transaminase is also an enzyme that is synthesized in the liver, and this is synthesized so that we can be able to utilize alanine as a source of energy. Alanine amino transaminase deaminates alanine and converts alanine to pyruvate and glutamate. So we get pyruvate and glutamate when we use AST. The liver synthesizes these enzymes and utilizes them, and these processes are done by the liver. So anytime the liver has got a dysfunction or this cellular damage, these enzymes leak into circulation. They are intracellular cytosolic enzymes that may be used for assessment of liver's dysfunction. The last thing that the liver does with the last two things that the liver does with the protein metabolism is to completely break down proteins that have been utilized to make ammonia. So ammonia is generated in the liver as we break down proteins. Ammonia is toxic, non-water soluble, and as soon as it's made, the liver immediately detoxifies it to form urea, which is now eliminated into the renal system. The last two things is that the liver uses protein as a steer to generate glycoproteins and lipoproteins. Note that lipoproteins are formed in the liver so that we can transport lipids from the liver to wherever they are needed. Lipids are non-water soluble, so when you attach them to proteins, then they become, or they're cheated that they are water soluble, so they can be transported to where they can be utilized. So proteins, that is the process. And then lipids, the last big metabolic function of the liver is on lipids. As we ingest lipids, they are emulsified in the stomach and in the small intestines. And unlike amino acids and glucose, lipids are particulate and they cannot travel in the blood that is in the hepatic portal vein. So they are taken up by the lymphatic system, and they are taken to the liver as particles or chylomicrons, and they are also stored like amino acids. So lipids stored like amino acids, and they are stored so that they can be utilized for two main functions. Lipids in the liver are esterified to form a compound known as cholesterol. Cholesterol forms a backbone for lipid-dependent hormones or lipid backbone hormones, and these are mainly the sex hormones. They have the sex hormones, testosterone, progesterone, estrogen, and cortisol and aldosterone. Those five hormones have a backbone from cholesterol that we form from the liver. Okay, so from the liver, the pool of cholesterol lipids that we got from outside becomes a backbone for the lipids, for the hormones that we need for our sexual maturity and sexual and reproductive functions. Now, the same cholesterol is broken down to form bile acids. Bile acids actually lipid excretory products. So this is where the liver is going to be an excretory organ. So bile acids are made from cholesterol breakdown, and primary bile acids are made, which are sent to the small intestines, and at the small intestines, the primary bile acids are converted by the normal flora into secondary bile acids. The secondary bile acids are now broken down. So they are now utilized to increase emulsification of lipids. So a scenario comes in that when we ingest a large amount of lipid, we don't excrete this lipid in stool. The first bout goes into the liver. The liver forms cholesterol, and cholesterol is immediately converted to bile acids, which is sent to the intestines by the in the biliary tree, and this bile acid now enhances emulsification of any amount of lipid that was left behind. So slowly, the lipid that we ingested is all taken up by enhanced emulsification using bile acids. So that is, we finished with lipids. So cholesterol and bile acids are excreted in the biliary tree. So excretory function of the liver also comes with that. So begins with lipid metabolism. Okay, minerals and vitamins will come under storage. So now the functions in the main metabolic functions of the liver, I've talked about carbohydrate, I've talked about protein, I've talked about lipids. Okay, I just want to summarize what I've said about the metabolic functions of the liver. In carbohydrate, we have glucose, glycolysis, glycogenesis, gluconeogenesis, and we have glycolipid and glycoprotein. In proteins, we have amino acid storage, we have synthesis of plasma proteins, we have ALT, AST, and then we have urea formation, and we have glycolipid and lipoprotein. Okay? In lipids, we have lipid backbone hormones, the sex hormones, and we have bile acid excretion. So this is the main function of the liver. The liver is a metabolic organ, and these are the metabolic functions. Now we go to other functions, which are subsidiary. And the subsidiary functions have alluded to excretory functions. Okay? The bile pigments and bile salts are excreted through the biliary tree from the liver. Okay? Hematological functions, outside formation of coagulation factors, the liver participates in formation of blood in intrauterine life. So the main blood forming organ in the fetus is the liver. So hematopoietic in the liver. Although as soon as the infant or the fetus gets out of the intrauterine environment, the liver ceases to be a hemopoietic center. Okay, so the liver produces the clotting factors, fibrinogen, and it synthesizes plasma proteins, and these are all hematopoietic functions. We've talked about those. Okay, now storage function is one that we are going to talk about next. Okay, so storage. The liver stores all materials that come to it. Glycogen and lipid soluble amino acids, vitamins are stored in the liver. The only water soluble vitamin stored in the liver is vitamin B12. And trace elements are stored in the liver. The main trace element here is iron. Okay, the liver is a protective function, and the protective function is only here the Kupffer cells of the liver perform phagocytosis to eliminate foreign compounds. The liver's functional unit is called a lobule, and around the lobule are arranged these Kupffer cells so that there is no invading microorganism or toxic material that can pass by without these phagocytes noticing it. So this is the only protective function of the liver. So the liver also breaks down toxic materials, all the xenobiotics that come in. Now on this detoxification, I have a little bit more to say. So on this fifth function, I want to expound a bit by saying detoxification by the liver is another major function. The liver detoxifies one of its own toxic end products, ammonia. And ammonia is detoxified through ammonia cycle. The liver has got a cascade of enzymes that synthesize ammonia. If you can refer to your amino acid ureas, the urea cycle enzymes, those enzymes are all found in the liver. Apart from that, they are found in the kidneys. So urea is synthesized in that urea cycle, and that's one detoxification process. So the liver detoxifies ammonia, although ammonia is also detoxified in the kidneys. So excess ammonia cannot be utilized as a test for liver dysfunction. Okay? So ammonia is synthesized. The liver also uses mechanisms that, other than this synthetic function of urea, the liver also uses mechanisms in which you add a compound to another, like adding a methyl group methylation or an alkyl group to a material would detoxify it. A majority of drugs and other toxic materials are detoxified by those processes, process of methylation and process of alkylation. The main detoxification process in the liver is that of conjugation. Bilirubin, a toxic material generated from heme metabolism, is detoxified by the liver. Bilirubin is initially synthesized in hematopoietic centers, reticuloendothelial system, from breakdown of heme that has been liberated from ruptured red blood cells. So heme is converted to biliverdin, and then biliverdin to bilirubin. Once bilirubin is made, it is picked up immediately by albumin, which is in circulation. So albumin takes bilirubin to the liver. In the liver, the bilirubin is combined or is conjugated to a UDP diglucuronide. Using UDP diglucuronide, we form bilirubin diglucuronide. You see, and this process is catalyzed by the enzyme glucuronil transferase. So bilirubin is detoxified, is rendered water soluble, and can now be channeled to the biliary tree and excreted. So this is the main detoxification process that occurs in the liver. And that this is the only organ in the body that detoxifies bilirubin. So bilirubin is a measure of liver's detoxification or excretory function. So in detoxification, bilirubin will be a measure of the liver's dysfunction. I have finished with the functions of the liver. Okay? So now what we go to will be the liver's function tests. In summary, what I've said, from what I've said, there are only a few functions of the liver that we can be able to use to assess its dysfunction. One, the synthetic function. Two, the enzymes that make glucogenic amino acids available to us. And three, the detoxification process of bilirubin excretion. Now, bilirubin is very significant, and it is because it's a majority of times when we have a liver disease, the main marker or the main indicator of liver's dysfunction is accumulation of bilirubin. Bilirubin is synthesized as when red blood cells are broken down, and in the liver is conjugated and excreted. Bilirubin can accumulate at three centers, or 3 points. One, before it enters the liver, in which case it is not the liver's problem. Or two, when it is in the liver and the liver is unable to completely detoxify it. Or three, when it is outside the liver on the other side and the liver is unable to expel it out of its own circulation. So jaundice, which is a major clinical presentation of the liver disease, may be a pre-hepatic, hepatic, or post-hepatic. Jaundice results from high levels of bilirubin. So bilirubin is a normal breakdown product from the catabolism of heme and is formed from the destruction of red blood cells. Normally, bilirubin is conjugated in the liver, making it water soluble. It is then converted to, excreted into the GI tract. The majority of which, in the biliary tract, the bilirubin is digested as urobilinogen or stacobilinogen, or stacobilin. Okay, so these are excreted. So 10% of urobilinogen is reabsorbed or recirculated. So bilirubin goes into the intestines, and the normal flora of the intestines break bilirubin to stacobilin and urobilin, the stacobilinogen or urobilin. And urobilin is recirculated and it goes back to the liver. Bile acids can also be recirculated. So bile acids and urobilin are recirculated to get into the back to the liver. So in bile acids, we may find both primary and secondary bile acids in the liver, and urobilin can be found in the liver, or it can be found in urine. So bilirubin is rarely channeled to urine, but in obstruction of its excretion, it may be seen in urine. So jaundice occurs when the pathways of transport of this bilirubin when disruption of these pathways occurs. So classically, in a liver disease, we have jaundice as a major presentation. We have abdominal pain, swelling, leg swelling, itchy skin, dark urine, pale stool. These are classical features in a liver disease. Okay, so when we examine or evaluate the liver, we are going to use tests, and these tests can be those that are truly function tests. And true function tests are serum albumin levels of bilirubin and prothrombin time. So albumin and prothrombin are synthetic, while bilirubin is excretory. So the other test that we will do will indicate liver cell damage or biliary tract disease. So liver function tests are either those that are utilizing the functions of the liver to assess its dysfunction, or those that are assessing the liver's disruption, liver cell disruption. And the second group here is one in which we have leakage of enzymes like ALT and AST. So what are they? Liver function tests, also known as liver function hepatic panel, are blood tests that measure different enzymes. There are different enzymes, proteins, and other substances made by the liver. So these tests check on the overall health of the liver, and the different substances that are often tested are the same in the same blood group. So we take one pool of blood and take a series of tests, and all of them are grouped together as liver function tests. I'm going to number them for you. Here, in the synthetic function, we have albumin, we have prothrombin, and total protein. So these are liver function tests. So as soon as somebody asks you or requests for liver function tests, these are mandatory things that come. Although the total protein and albumins are used mainly when there's a chronic liver disease. Prothrombin is one that is used in an acute stage of liver disease. So the liver enzymes that are tested for, and these are the ones that indicate a hepatocellular damage, are ALT, AST, and alkaline phosphatase and gamma-glutamyl transpeptidase. And we also have one called 5' nucleotidase. Although 5' nucleotidase is no longer used properly, or no longer used in any panel. So the panel here, if I go back to the first group here, we have 1, 2, 3 in the panel. If I ask you what is the liver function test panel, take these first 3, and then you get number 4 ALT, 5 AST, 6 ALP, 7 gamma-glutamyl transpeptidase. And do not forget that the excretory function always comes in. It is either in acute stage or in chronic stage. So both chronic liver disease, we have bilirubin as a marker. A majority of times, the bilirubin determines whether it is really a liver disease or not a liver disease. So the major function tests are classified, and they are tests of excretion, and these ones measure bile pigments like bile salts. And this is a very old test. Bromoxaftolin is an old test which used to be done long ago. Okay, bile acids are no longer measured for a liver disease. Okay, so and the excretory function here is now just bilirubin. Okay, so it's not bile acids anymore. The bile pigments contain bilirubin, and bilirubin is the main thing measured. So the tests are those of enzymes from the liver, and they usually transaminases. Okay, the transaminases are the main ones that talk about liver cell damage. And alkaline phosphatase, 5' nucleotidase, and gamma-glutamyl transpeptidase are also excreted products or products of cellular damage, although they may be used for an obstructive process. They are increasing circulation because they are excreted during the same time the bilirubin is excreted is when these enzymes are also excreted. So the metabolic capacity of the liver, these are rarely done these days, but galactose tolerance and antipyrin clearance are the main things. And the tests that were done for synthetic function are prothrombin time, acute, and serum albumin, chronic. Okay, and detoxification, which is this hippuric acid synthesis. It's a very old test. So exclude the hepatic synthesis test for detoxification, or for bilirubin in detoxification process. Now I have come back to what the actual tests that are going to be done in liver dysfunction. So the actual tests are, so in serum, we have the synthetic function of the liver, albumin. So albumin is the one which lives longest in circulation. So if we have if this will have low albumin, it means this process has been there longer than 20 days. So it's in chronic, it's a chronic marker. So the low albumin in serum commonly observed in patients with severe liver damage. So in the acute periods, we may have low albumin, but in severe liver damage. In other words, the liver is not doing anything at all. So in chronic liver disease or in chronic malnutrition, we'll have low albumin as a marker. Okay? Prothrombin is synthesized. Yeah, so the liver synthesizes all the factors in clotting, almost all the factors in clotting. A decrease in concentration of plasma clotting factors is found in impaired liver function. Prothrombin time is prolonged in acute liver disease. Normally, it is for 10 to 15 seconds, so anytime you get it longer than that, it is a synthetic functional test of acute liver disease. Total is decreased in severe malnutrition and in chronic liver diseases. So in chronic liver diseases, you also have decreased prothrombin, but albumin is the main one. Okay? Serum and the serum enzymes, a large number of enzymes are estimated, are available for liver function test. So they are divided into two groups. The ones that are done most commonly or routinely are AST and ALT. Reverse the order, ALT comes first. ALT is the main liver enzyme. Okay, so ALT comes first, then AST. The other ones are not done routinely, but they are done in conjunction with these others, and they include the alkaline phosphatase, gamma glutamyl transpeptidase, and 5' nucleotidase. Those are the other ones. They are not done routinely, but they are included in the function panel. Okay. ALT elevations, you can go over that slide. These are the other things that cause elevation of ALT. But the only thing that we're going to pick here, or the only thing we're going to note here, is that ALT is mainly a liver enzyme. Elevations occur in acute liver disease, acute liver failure, alcoholic liver disease, neoplasm of the liver, hepatitis, non-cancerous, everything is talking about the liver, okay? It's liver cell tissue death. So ALT is the main liver enzyme, okay? So AST is found in both cytoplasm and mitochondria, and it reflects damage to hepatic tissue, and it's less specific. It's not correct to say less specific, because if you have a clinical picture where the liver is incriminated, the elevation of this enzyme will always be specific. But in a situation in which you do a serum assay and you only pick one enzyme, it may appear less specific. It can be released in the heart, muscle, and brain. Rarely do we have symptoms that occur in the liver's region that associate the heart, the muscle, and the brain. So it is indeed, it is specific if the symptoms are pointing at the liver. Okay, the AST is commonly used as a hepatic enzyme, or as a cardiac enzyme. Okay? This is telling you that it's elevated in other areas, although it can be elevated in the liver's tissue. Alkaline phosphatase is a hydrolase and is responsible for removing the phosphate groups from any types of molecules, including nucleotides and proteins. It is synthesized in the liver. So ALP occurs in all tissues. And the liver is one of the all tissues. Okay? It occurs in bone, liver, bone, and bile duct and kidney, the placenta. ALP is used to help diagnose certain liver diseases, and the certain liver disorders are mainly those in which we have excessive cellular damage and an obstructive process to liver excretion or excretions. Most effective is the main alkaline phosphatase inverse. The levels are significantly higher in growing children, and the rise in ALP is associated with elevated serum bilirubin. Is an indicator of biliary obstruction. So obstructive liver disease or obstructive jaundice, we have elevated of ALP. So ALP is the other enzyme, and when you suspect an obstruction is when it is incorporated in the panel, in the liver function test panel. Gamma GT is a microsomal enzyme, and it's also widely distributed. The measurement of gamma GT activity produces a sensitive index to liver's abnormality. So it's made in the liver, and when the liver cells are damaged, it pours out. So the activity of this enzyme is also useful alongside ALP in hepatic damage. Okay? Hepatic damage leads to elevated, all the enzymes made in the liver are elevated. So serum gamma GT is usually elevated in obstructive jaundice. Gamma GT is elevated also in chemical hepatitis or chemically induced liver disease. Gamma GT is the enzyme that is markedly elevated. And the chemical we commonly ingest is alcohol. So in alcoholic hepatitis, gamma GT is elevated. Okay? Some drugs that are used for our patients may also increase gamma GT, and one of them is phenytoin sodium, a drug used for epilepsy, and this induces liver synthesis of this gamma GT. So it is increased in circulation. You must rule out the presence of phenytoin sodium in these individuals. 5' nucleotidase is the serum, so the serum activity is elevated only when there is an obstruction. So 5' is not, so it is supposed to be a selective, it's supposed to be an enzyme to help you select between the sources of ALP. So if we did a liver serum assay of enzyme and we found only an elevated alkaline phosphatase, for us to tell whether the alkaline phosphatase is coming from the liver or not, it is the 5' nucleotidase which will help. An elevation in ALP and elevation of 5' nucleotidase suggests that the liver is the main source of alkaline phosphatase. I'm almost finished. So this is the only metabolic capacity test that used to be done, but you can be able to mention it if you want to say, you want to assess metabolic capacity. Galactose tolerance. Galactose is almost exclusively metabolized by the liver. Galactose and fructose are also sources of sugar or glucose in synthesis of glycogen. So galactose and fructose enter the synthetic cycle at different points. So galactose is one of them. The liver's function can be assessed by a measurement of its utilization. So what we do is the subject is given galactose, and the amount here is variable. It depends on what size of person you are thinking about. But usually 300 milligrams per kilogram body weight is given. So you inject that amount of galactose into circulation, and then you give this person a few hours, or half an hour, assess the amount of galactose in circulation. 1 hour, assess the amount of galactose in circulation. So if the galactose is not being reduced, then the liver's functional metabolic capacity is impaired. Okay? So reduction in galactose in circulation corresponds to liver's functional ability. Okay? So this is one that was used before. Now, bilirubin is the last one of these things. This is the major indicator of the excretory function of the liver. It's elevated. Elevation of conjugated bilirubin is seen in serum implies liver or biliary disease. Any elevation, liver or biliary disease. It's important to note that only conjugated bilirubin appears in urine. So if we have an obstruction, then we'll have an elevation in bilirubin in circulation and also an elevation of bilirubin in urine. So an obstruction will give you both. Okay? Presence of unconjugated bilirubin in serum suggests the presence of a prehepatic cause. So it's not really the liver, it's something before the liver. Okay? If it is in the liver, it's a failure of the liver to conjugate. Okay? So hepatic disease in which the liver is unable to conjugate. Okay? And the presence of bilirubin in the urine almost always means there's a liver disease. There is no time we have bilirubin in urine until it is water soluble. And the water soluble bilirubin can only appear if there's a conjugation that has occurred. Okay, so a liver disease, if bilirubin is in urine, you have a liver disease. This is a case in which a woman was found to have the following liver function test as part of a routine assessment. Now, albumin, I said, was for chronic liver disease. Okay, the albumin is normal level here. Bilirubin is slightly elevated. Okay, and then AST, ALT, and alkaline phosphatase are all normal. So this is likely to be a prehepatic jaundice in this patient. Prehepatic elevation of bilirubin in this patient. Okay, so this is a patient who has got a normal liver function and the bilirubin is elevated. This is a one case study. Okay, the other case study is this one. Here I've given you a second-year medical student has returned to college from a 2-month holiday upcountry. He presents with a 3-day history of malaise, fever, and yellow eyes. And his liver function results are bilirubin elevated, albumin normal, total protein normal, prothrombin time elevated, alanine aspartate, and alkaline phosphatase, alanine transaminase and aspartate transaminase elevated. This is an acute liver disease, and the bilirubin here is likely to be unconjugated or mixed. Okay, so these are the cases that I have here. So you can look at them critically at your own time. And here I end my talk on liver functions and liver function tests. And then I want to ask for questions